This is a scenario-based station designed to evaluate your ability to perform a successful patient assessment. You will be given signs and symptoms appropriate for the patient's condition. You may use any of the supplies and equipment available in this room and have 10 minutes to complete your assessment. Do you have any questions?
I do not.
You have arrived at a scene to find a 25-year-old female who presents with audible wheezing and red blotchy areas on her abdomen, chest, and arms after eating cookies she purchased at a bake sale.
BSI, is the scene safe?
Scene is safe.
Alright, number of patients?
1.
Alright, I'm going to call for ALS backup.
ALS backup's en route.
I'm going to consider C-spine, but it is not indicated. And the nature of illness appears to be an allergic reaction based on my general impression of a 25-year-old female complaining of itching and wheezing. Hey, my name is Evan and I'm an EMT. Can you tell me what's going on?
Yeah, I started itching about 5 minutes after I ate these cookies, and that was about 20 minutes ago.
Alright. Do I see any life threats?
No visible life threats.
Alright. She has a spontaneously patent and clear airway. I'm going to assess her breathing for rate, rhythm, and quality.
26, wheezing and deep.
Okay. I'm also going to assess circulation. What is the rate, rhythm, and quality of the pulse?
Pulse is 120, weak. Skin is cold and clammy.
Okay. I'm going to administer oxygen to this patient, designate her as high priority, and rapidly transport. Alright, so when did you start experiencing these symptoms?
About 5 minutes after I ate.
Has it been getting any better or worse?
My wheezing seems to be getting worse, and I'm starting to sweat.
Do you have any allergies?
Yeah, to peanuts and penicillin.
Okay. You take any medications?
Not right now, but I do have my EpiPen.
Okay. Alright. Has this ever happened to you before?
Yeah, the last time it happened, I was in the hospital for 2 days.
Okay. Were the cookies the last thing that you ate?
Yep.
Okay. And how were you before you ate the cookies?
I was fine. I was fine until I ate the cookies, and then all the symptoms started then.
Okay. At this point, I will obtain a complete set of baseline vitals by taking the patient's blood pressure.
Blood pressure is 104/72.
Her vitals and a general deteriorated condition gives me a field impression that the patient is experiencing anaphylactic shock. After ensuring the EpiPen is prescribed to the patient and that it is not expired, I will assist the patient in administering a proper dose by applying the EpiPen to the lateral portion of her thigh, stabilizing the leg, and holding for 10 seconds. After administering the first dose, I will monitor the patient's vitals and overall condition. Throughout transport, I will continue to monitor the patient's vitals and overall condition to determine if she needs additional epinephrine. I will also notify the hospital that the patient showed signs of anaphylactic shock, and I administered 1 dose of her epinephrine via EpiPen, and I'll also inform the hospital that her last complete signs of vitals show that she had a heart rate of 98 beats per minute, a blood pressure of 120/80, 20 respirations per minute, and an SpO2 of 98%. After asking the hospital if they have any further orders or questions, I will inform them that our arrival is in 5 minutes.
Is there anything else you'd like to do for this patient?
No.
Thank you.